Electronic cigarettes have attracted media and consumer attention for claims of their addictive nature, variety of flavors, and increased use among teens, sparking regulatory oversight and policies. A Penn State College of Medicine study suggests that these devices may help people decrease their dependence on combustible cigarettes, which contain an array of harmful chemicals called toxicants, without increasing their overall nicotine dependence. Smoking is a leading cause of death in the U.S., and despite interest in quitting and the availability of FDA-approved cessation methods, smokers still struggle to quit. Some public health experts have proposed e-cigarettes as a reduced-harm alternative to cigarettes for those not interested or able to quit, citing reports like one from the National Academies of Sciences, Engineering and Medicine, which found that substitution of e-cigarettes for combustible cigar. Their latest study investigated a common question: whether initiation of electronic cigarette use to reduce cigarette smoking could potentially increase nicotine dependence. Research on this topic is conflicted because, in prior studies, participants used their own devices with unknown nicotine delivery profiles, Yingst said. Our study used devices with known nicotine delivery profiles, which allowed us to effectively compare how the varying levels of nicotine in a device might affect user nicotine dependence and ability to reduce cigarette consumption. The researchers enrolled 520 participants interested in reducing. Participants self-reported their cigarette and e-cigarette dependence at 1, 3 and 6 months using validated measures of dependence, including a Penn State-developed questionnaire that ranges from 0, not at all dependent, to 20, highly dependent. Urine samples were also collected throughout the study to measure catenin, a biomarker for nicotine exposure. At 6 months, all participants in the e-cigarette groups reported significant, decreased cigarette consumption, with those in the 36 mg per milliliter group smoking the least number of cigarettes per day. Participants also reported their e-cigarette dependence using the Penn State e-cigarette dependence index. E-cigarette dependence did not significantly change throughout the study, with the exception of participants in the 36 mg per milliliter group who saw significant, increased dependence over the course of the study, yet still much lower when compared with cigarette dependence. The results were published in the journal Nicotine and Tobacco Research. Our results suggest that using e-cigarettes or a cigarette substitute to reduce cigarette consumption can result in a reduction of self-reported cigarette use and dependence, said Yingst, who directs the College of Medicine's Doctor of Public Health program. Importantly, use of the high-concentration e-cigarette did not increase overall nicotine dependence, and was associated with a greater reduction in cigarette smoking compared to the cigarette substitute. While it has been hypothesized that the use of e-cigarettes could increase overall nicotine D. In the future, they will evaluate the health effects of completely switching from cigarettes to e-cigarettes. Folds has done paid consulting for pharmaceutical companies involved in manufacturing smoking cessation medications, e.g. Pfizer, GlaxoSmithKline, Johnson & Johnson, and has acted as a deposed and compensated expert witness on behalf of plaintiffs suing cigarette manufacturers. Other author disclosures can be read in the published manuscript. This research was supported by the National Institute on Drug Abuse of the National Institutes of Health and the Center for Tobacco Products of the U.S. Food and Drug Administration. Grant numbers P50DA036105 and U54DA036105. Data collection was supported by Penn State Clinical and Translational Science Institute. Grant number 01TR002014. And the C. Kenneth and Diane Wright Center for Clinical and Translational Research at Virginia Commonwealth University. Grant number 01TR002649. Through the National Center for Advent. The content is solely the responsibility of the authors and does not necessarily represent the official views of the sponsors. Materials provided by Penn State. Original written by Zach Sweger. Note: content may be edited for style and length. Jessica Yingst, Shi Wang, Alexa A. Lopez, Allison Breland, Eric Soule, Andrew Barnes, Joanna Cohen, Megan Underwood, Melanie Crabtree, Jonathan Folds. Changes in nicotine dependence among smokers using electronic cigarettes to reduce cigarette smoking in a randomized controlled trial. Nicotine Tobacco Research, 2022, doi 10.1093, NTR, NTAC 153 Penn State. E-cigarette use to reduce cigarette smoking may not increase nicotine dependence, study suggests. Science Daily, the 16th of August 2022. ift.tt/x96hacks. Penn State. 2022, August 16. E-cigarette use to reduce cigarette smoking may not increase nicotine dependence, study suggests. Science Daily. Retrieved August 16, 2022 from ift.tt/x96hacks. Penn State. E-cigarette use to reduce cigarette smoking may not increase nicotine dependence, study suggests. Science Daily. ift.tt/x96hacks. Accessed August 16, 2022. Thanks for watching. Please subscribe my channel for more videos.